looking forward to it. Absolutely. It should be very interesting.
I came because we work very closely with Dr. Petrosian, referred him a lot. I'm brand new, about 7 months, just practicing. I want to know exactly what are they doing, how is the procedure.
All integrated all together in one single day session.
I attended the conference to see the live TAVR.
The attendees in the audience will benefit from the information and the education provided through the live case at St. Francis.
Definitely know a little bit about valvular procedures, but it's always good to learn more, and these speakers today are phenomenal.
To synthesize everything we've learned, the treatment of valvular heart disease, bring it together, increasing availability of these techniques to our patients on Long Island.
Get out in front, let the community know where we're going and what the potential is.
Oh, it's really a remarkable experience.
So we do this technique in all our patients. If for some reason we can't go up and over like we've done here, let's say the patient's anatomy is too diseased.
We've been successful in developing a first-rate TAVR valve program. We're one of the largest programs in the country. We've been involved in numerous pivotal research trials, and we've begun to be involved in mitral research trials. We've done some transcatheter mitral procedures, and the technology is evolving.
As you see, Dr. Robinson is loading the ProGlide over a wire.
As a surgeon, I've been involved in finding ways to reduce the trauma of surgery. In 1996, I implemented a program, minimally invasive heart surgery at St. Francis Hospital. Of course, in the early years, there were learning curves and learning experience for the surgeons worldwide, but as this has become mainstream therapy, we get away from the so-called sternal splitting the bone in the front of the chest, just puncture sites in either the artery or the vein. It's remarkable, it's transformative to work together as teams, interventional cardiologists alongside the surgeons to find the best therapies for patients. So the idea of this symposium is to bring it together in a public way, get the word out. It's quite remarkable, of course, to consider that the replacement of an aortic valve via sternotomy would require 7 to 10 days in the hospital, 6 to 8 weeks in recovery. The minimally invasive approach to aortic valve replacement might require 5 days in the hospital with 3 weeks to recovery. The transcatheter approach to aortic valve replacement is done in 2 hours. The patients can be home in a day or 2 and fully recovered easily within a week's time.
The risks of ballooning it are...
We're very happy at how we performed and how the patient did during the procedure. The patient is fully awake now, recovering from the procedure, and we expect him to go home tomorrow.
We're very pleased with the turnout. I was proud to be part of it. I thought that all the speakers did a great job in terms of their talks and communicating the message. And the feedback I got was the people in the audience really enjoyed it.
I'm learning a lot about placement of the valve. That was my most interesting part.
We take care of open heart patients right out of the operating room, the TAVRs as well. So it's really nice to see firsthand what's really happening.
When they come out, we have to make sure they're very still, there's no bleeding or anything like that. We're always checking those groins, and now I see why.
So now when the patients ask me, I can even better describe to them exactly what the procedures are.
To see the full inside picture of everything that goes on in the operating room, and now I feel like we can actually answer questions better for the patients.
With all the information on valve procedures and the testing required for it and all the diagnostics leading up to it, and the live case was a phenomenal thing to see.